Have you felt a weird, numbing, tingly, burning patch on the outside of your thigh? Almost like your pocket is on fire, but there's nothing actually there? You may be dealing with a condition called Meralgia Paresthetica. And today, we're breaking it down and discussing what it is, where it comes from, and most importantly, how to fix it. This is Dr. CeCe. Let's dive in. Meralgia paresthetica is a condition caused by an irritated nerve called the lateral femoral cutaneous nerve. It's a tiny little nerve with a very big name, and it can cause a lot of drama. It has one very simple job: to provide sensation to the outer thigh. It has no motor capabilities, so it doesn't move anything. It's just pure sensation to the outer thigh. And when that nerve gets squished or compressed, it lashes out and you get burning, tingling, and numbing patches, and increased sensitivity to even the lightest touch on the outside of your thigh. Typically, this condition usually affects only one side of the body, and it may radiate from your outer hip area down to the outer side of your knee. Some even report deep muscle aches in the thigh, groin, and buttocks. Symptoms can worsen with activities that involve prolonged hip extension, like standing and walking, while they may be relieved by sitting or flexing the hip. The intensity of the symptoms can range from mild to severe, potentially affecting daily activities. The lateral cutaneous femoral nerve comes from the L2 and L3 roots of your lumbar plexus and travels across your pelvis and sneaks under the inguinal ligament right near your front pocket. The lumbar plexus is one of 5 spinal plexuses in your body. Think of a spinal plexus as the Wi-Fi router of the spine that branches out and sends signals to the skin and muscles throughout your body. This particular nerve gets irritated by basically anything that compresses it where it passes under your inguinal ligament. When a nerve is squeezed or pinched by surrounding tissues, this compression disrupts function. This can happen from external pressure or internal swelling and leads to symptoms like pain, numbness, tingling, weakness, and of course, burning. Common causes include repetitive motions, past injuries, and certain medical conditions like diabetes or arthritis. So, if that particular area is compressed, boom, your thigh complains. The worst offenders: tight jeans and tight belts. Yes, skinny jeans have consequences. As a chiropractor, I see this a lot, especially with young women and their tight jeans, overweight men with tight belts, especially under big bellies, and police officers because of their heavy gun belt and pistol on their hip. Other offenders are heavy tool belts or waist straps, weight gain, pregnancy, long periods of standing, and hip flexor tightness. Even sitting with your hips flexed for too long can irritate this nerve. So, how do you know it's Meralgia Paresthetica and not something else, like, say, Sciatica? Both conditions can cause pain and numbness. The location and the nerve involved are the key differences. The affected nerve behind sciatica is the sciatic nerve, and its primary location is the back of the leg, back of the thigh, calf, and foot. Pain often extends beyond the thigh, down into the leg and foot. The affected nerve behind Meralgia Paresthetica is the lateral cutaneous femoral nerve, and its primary location is the outer thigh. Starting around your pocket area, just below your hip, and ending just above the outside of your knee. The pain does not go below the knee. Even the symptoms differ. Sciatica has a sharp, knife-like or electrical pain radiating from the lower back or hip down the back of the leg. Meralgia paresthetica has a tingling, numbing, burning pain, and is hypersensitive to touch, even the lightest touch on the outer thigh. A simple self-check is tapping or pressing near your front pocket area. That recreates the tingle, and that is a big clue as to whether it's Meralgia paresthetica or sciatica. The good news is that this is one of the most fixable nerve irritations, though it may mean changing up your style, like ditching those tight jeans. Loosen compression by switching to looser pants and avoiding thick, tight belts. Also, adjusting uniforms and tool belts. You can reduce inflammation by icing the front pocket area for short intervals and reducing prolonged standing. Mobility and soft tissue work like gentle hip flexor stretching and stretching out those quads and that IT band. Also, abdominal hip flexors work to reduce anterior pelvic tilt. You can also improve posture and pelvic mechanics by strengthening your glutes and reducing hip flexor dominance, as well as addressing any glute asymmetries. If needed, nerve glides for that lateral femoral cutaneous nerve, and I'll show you how in just a few minutes. You may also need professional treatment like regular chiropractic adjustments, physical therapy, or manual therapy. Nerve glides are perfect for calming down nerve irritation. Nerve gliding, also known as nerve flossing or neural mobilization, is a therapeutic exercise technique that involves gentle movements to help nerves move smoothly and improve their mobility. It works by basically flossing the nerve through its surrounding tissues to reduce pain and restore normal function, and it decreases tension and compression. This technique is commonly used for conditions like carpal tunnel syndrome and sciatica. How it works is nerve gliding involves a sequence of stretching and relaxing movements that slide the nerve back and forth. This allows the nerve to glide more freely within its sheath, which can increase blood circulation and reduce inflammation. And it helps to work out tension and restore the nerve's normal range of motion, especially after an injury or surgery. You should feel a mild stretch or tingling, but no pain. Let's do a seated nerve glide for Meralgia paresthetica. Sit upright on a chair with your feet flat on the floor. Extend the affected leg straight out in front of you, keeping the knee straight. Alternate between two positions, moving your foot and head at the same time. Position 1, point your toes down and bend your chin to your chest. Position 2, point your toes towards your knee and tilt your head back. Repeat this smooth, alternating motion for 15 to 20 reps. Go slow and controlled, and stop if you feel any sharp pain. Remember, This exercise should feel like a gentle glide, not a painful stretch. It's best to do these exercises 1 to 3 times a day. Consistent daily performance for about 6 to 8 weeks may be needed for lasting improvement. And as always, please remember to follow the advice of your physical therapist or your doctor, as improper execution can cause worsening symptoms. Nerve gliding is most effective when combined with other treatments, such as massage, corrective exercises, and of course, chiropractic adjustments. The prognosis for Meralgia Paresthetica is generally good, with most cases improving or resolving completely with conservative treatment such as weight loss, loose clothing, and avoiding tight belts. For those who don't improve, treatments like corticosteroids, nerve blockers, surgical decompression, or neuronectomy can lead to complete or significant pain relief. But surgery is not always fully successful, and symptoms can sometimes persist or reoccur. About 85% of people with Meralgia Paresthetica fully recover with just conservative treatment, which involves avoiding pressure on the nerve by, as we said, wearing looser clothing and avoiding tight belts and, of course, weight loss. Many cases improve or resolve on their own, especially if the underlying cause is temporary, like pregnancy. Now, permanent nerve damage can occur in some cases, particularly severe ones. Meralgia paresthetica can lead to permanent damage to the lateral femoral cutaneous nerve. If your symptoms are getting worse, worsening numbness, severe pain, or symptoms have spread to both sides, go see a professional. This nerve is small, but it should not rule your life. If you found this information helpful, hit the like button and subscribe for more natural solutions to everyday common issues. This is Dr. CeCe. Thanks for watching. See you next video.